The treatment of patients with in-stent restenosis is a very important clinical problem, which occurs in approximately 10% of patients in a real-world setting. And the in-stent restenosis is thought to result from aggressive neointimal proliferation or near atherosclerosis. And currently we have two options to treat in-stent restenosis. First, we have the drug-eluting stents, and of course we have drug-coated balloons. The drug-coating balloons rapidly transfer anti-restenosic drugs to the arterial vessel without adding another metal layer. For that reason, we want to test a new balloon, which is called AGENT-ISR, in comparison to a commercially available sequent Blease drug-coating balloon. The difference between both balloons is that the excipient coating is different. AGENT-ISR balloons are using an acetyl-3-butyl citrate, also containing paclitaxel as a drug, and the excipient coating for sequent Blease is iochromite, also with the paclitaxel inside. However, the drug dosage is reduced with the AGENT-ISR, which means that we only use 2 microgram per square millimeters. The major endpoint was the in-stent lumen loss at 6 months post-procedure. That was measured by an independent blinded QCA laboratory. And we have also some additional endpoints, clinical endpoints, such as death, myocardial infarction, TLR, target lesion revascularization, target vessel revascularization, and of course, stent thrombosis. And what we find after investigating 125 patients with a follow-up of 12 months, we could see that the late loss at 6 months was not inferior in the AGENT balloon in comparison to the sequent Blease. Well, from the AGENT-ISR study, which was the first head-to-head comparison of 2 commercially available drug-coating balloons, we could see and show that the AGENT-DCB with a lower drug concentration in comparison to the sequent Blease is non-inferior for treatment of in-stent restenosis in terms of in-stent late loss at 6 months. And of course, we need a longer-term follow-up evaluation. However, we could show similarity between these 2 DCB devices. As we all know, the randomized trials for DCB are limited and data are rare. For that reason, I think this is another study which brings some evidence to the clinicians, showing that we can use also AGENT-DCB in comparison with a comparable result to the sequent Blease, which is very well tested in randomized trials. For that, we have another alternative to treat in-stent restenosis in our clinical practice.